Pooja, you left the job and still so cool?
Bro, new challenges bring new opportunities.
Oh, really?
Seriously, Rahul, my entire house, now it's an online retail store. Look.
Wow. But money?
Few years back, I'd invested my Diwali bonus.
And now you have LIC's ULIP plan Nivesh Plus. Invest once, get the benefit of both life insurance and maximized returns based on market trends.
One sec, Rahul.
Madam, you are double cool.
This is NDTV, and you're watching NDTV 24/7.
Hello and welcome to this special show, Defeat Diabetes. I'm Ankita Mukherjee. As India emerges from the pandemic, it's necessary to bring the focus back on managing chronic lifestyle conditions like diabetes. India has the rather dubious distinction of rapidly becoming the diabetes capital of the world. Indians are genetically more prone to developing diabetes. The risk increases because of our carbohydrate-rich diet. The more worrying aspect of diabetes in India is that an increasingly higher number of younger people are now being diagnosed with diabetes. And it is vital that people are made more aware of the challenges posed by diabetes so that they're better prepared to defeat diabetes. To discuss these and other issues, we have with us an esteemed panel of medical experts. Joining me on the show today, Dr. A.K. Das, former professor and head endocrinology of JIPMER, PIMS, National President of API and RSSDI. We also have with us Dr. Sujoy Ghosh, Department of Endocrinology in IPGMER, Kolkata. He's Honorary Secretary of the Endocrine Society of India and Joint Secretary of RSSDI, Program Director of the Type 1 Diabetes Task Force of the Government of West Bengal as well. We're also being joined by Dr. Banshi Saboo, National President of the RSSDI. Let me begin with Dr. Saboo, in fact. Dr. Saboo, if a person has diabetes, then does his or her risk of developing cardiovascular disease more than double that of the general population? And if this is indeed the case, then is there a direct connection between diabetes and heart disease?
Yes. So first your question is the patients with diabetes are at more risk of developing heart disease. If you see it has both common pathophysiology. The persons with obesity, persons with sedentary lifestyle, persons with has common risk of developing diabetes as well as heart disease both. So many of the times, what we see, even a person without developing diabetes, they may develop coronary artery disease also. But both of them have common pathophysiology. But definitely persons with diabetes and with other risk factors like smoking, with hypertension, with higher cholesterol, they are also at higher risk of developing heart disease. Nowadays, we also call that person with diabetes is like almost equivalent risk of developing heart disease. So if any persons to whom we have to treat diabetes, 2/3 of them are going to develop heart disease. So they have to be very, very aggressive to control not only for diabetes but also to prevent the heart disease also.
Yes, you're saying patients have to be particularly aggressive in controlling the condition. Dr. A.K. Das, is this more so because diabetes can actually affect almost every body part? And do the complications start showing up immediately after diabetes is detected in a person, or does it take time for these complications to actually begin to appear?
It's a very interesting question. I'll like to answer that. The issue is that diabetes is a silent disease,
right?
And when it is diagnosed, some time has elapsed. Therefore, they present for the first time with the disease and complications, which is already present in them. The second point is the fact that diabetes can affect from head to toe. The question regarding how much time it takes to produce complications, I will answer this way. In the type 1 diabetes, which occurs in children, for the eye disease, it takes 5 years. For the kidney disease, it takes minimum about 10 years. And the heart disease, about 15 years. But for type 2 diabetes, which is the garden variety and our most important issue. One can have eye disease at the onset,
Okay.
kidney failure at the onset, and heart attack at the onset.
So you're saying effectively that type 2 diabetes can be associated with very sort of rapid changes or rapid complications as well. Dr. Ghosh, let me come to you. Diabetes seems to be associated with both microvascular and macrovascular diseases that affect several organs. These can be the muscle, the skin, the heart, the brain, and kidneys. Can you explain to our viewers, these terms, microvascular and macrovascular, and what it is they should be looking out for?
Good day, and first of all, thank you for having me on the show. And in continuation with what Professor Das was talking about, he was trying to tell us that diabetes might be asymptomatic, and therefore by the time you diagnose, there's an underlying complication. And essentially, diabetes affects blood vessels. Now, in the body, you have blood vessels everywhere, whether it's the toe, whether it's the head, whether it's the foot, whether it's the kidneys and the eyes. Now, the size of the blood vessels in each organ system of the body is different. Some are small, some are bigger in caliber. So the bigger vessels are present in the brain, so you have the blood supply to the brain. You have bigger vessels supplying to the heart as well as to the feet, for example, blood supply of the limbs. Now these bigger vessels are macrovascular. So whenever you have complications of these bigger vessels supplying the bigger organs in terms of the brain, heart, you call it macrovascular disease.
Right.
And when this affects smaller vessels, for example, the vessels in the kidneys are very tiny, in the eyes, in the retina are tiny, in the nerves they are tiny, so you call it microvascular disease. So even though we are, trying to use this kind of a watertight compartment of microvascular and macrovascular disease, the basic disease is the same,
Right.
depending on where and which kind of blood vessels are getting affected. The individual is likely to have complications related to that.
Dr. A.K. Das, let's take a further deep dive into this. Diabetic neuropathy is a very serious complication of diabetes. Around 60 to 70% of people with diabetes seem to present with some form of neuropathy or nerve damage. Is this something that can be reversed?
I think it's a very, very important question. The diabetes neuropathy are divided into two types, reversible and irreversible. Some neuropathies, which occurs in the eyes, we call it diplopia, is totally reversible. One neuropathy occurs in the thigh muscle, called femoral neuropathy, is totally reversible. But the garden variety of neuropathy, which you describe 70%, which occurs as tingling, numbness, pain, burning, muscle weakness, mostly in the feet, sometimes in the hand, is not usually reversible. It is a function of the metabolic defect, that is the high blood sugar, fat, as well as the blood vessels. And one can reverse certain extent, but one cannot reverse it totally, but can control with treatment. The key to reverse diabetic neuropathy is to diagnose diabetes early by screening, maybe universal screening or opportunistic screening of the family relatives of diabetics. But once it is diagnosed, a strict diabetes control, no smoking, blood pressure control, and smoking, and most important, alcohol cessation, then one can possibly reverse diabetic neuropathy.
This question going to Dr. Sujoy Ghosh. Dr. Ghosh, there are many people with diabetes who suffer from diabetic ketoacidosis post-recovering from COVID. Now, when you see your patients, is this just a complication that has happened because they've also suffered from COVID, or is it common in people with diabetes?
Right. First of all, let me clarify. Diabetic ketoacidosis happens when you have an absolute deficiency of insulin. So, for example, type 1 diabetes is a situation where there is no insulin production. That often presents with diabetic ketoacidosis, or later on, if there's a problem with the insulin therapy or there's an underlying infection, you might have diabetic ketoacidosis. In type 2 diabetes, which is more than 95% of all diabetes that we usually see, diabetic ketoacidosis can happen, but that's relatively rare. In the COVID times, we've probably seen more people presenting with diabetic ketoacidosis and not necessarily after the COVID. So if somebody's developed an absolute deficiency of insulin, and there are a few theories that's going around, we still don't know the exact pathophysiology or the mechanism why such a thing happens, is that individuals might be affected directly by the virus attacking the pancreas and causing insulin deficiency. And that can happen more so if an individual has required steroids therapy in the background of an absolute deficiency of insulin, which might precipitate the ketoacidosis. However, to think that you've suffered from COVID, recovered from COVID, thereafter you did not develop absolute insulin deficiency, there is no worry to think of that you will develop ketoacidosis.
All right, that's an important clarification. Thank you for that, Doctor. We are going to take a very quick break at this point. We've already discussed in detail diabetic neuropathy and diabetic ketoacidosis. When we come back, we'll turn our focus to diabetic retinopathy as well. We'll be back in just a moment with our medical experts to answer all your questions. You're watching Defeat Diabetes, where we have medical experts talking about how you can manage your metabolic conditions and keep diabetes in check. Let me go straight across to Dr. Banshi Saboo. Dr. Saboo, diabetic retinopathy is a potentially serious eye disease that can result in permanent distorted vision or even loss of vision altogether. Just how common is it, and are there different types of diabetic retinopathy as well? How can we detect it at an initial stage? Are there any symptoms? What should patients be looking out for?
So diabetic retinopathy is very common, and it's really very serious condition. It can lead to permanent loss of vision also. And this is very important for every one of us and who are at the risk of developing diabetes or who are diabetes. They should know about that this can be a serious complication of diabetes. It can be detected as early as even with the patients who are diagnosed with type 2 diabetes, as Dr. Ashok Das was talking, that even at the time of diagnosis also, we may find some of them with the retinopathy also. But what we see for all type 2 diabetic patients, we ask them to regularly screen every year for diabetic retinopathy. This is one of the best way to screen these patients and then for prevention of further development or progression of diabetes retinopathy. As we know, for any complication of diabetes, whether it's a retinopathy or as we are talking of other complications like neuropathy, the progression can be halted by a tighter glycemic control. And that's the only answer. For each and every one, they should have a tight glycemic control, regular monitoring and screening of this complication, and they should be screened as early as possible, even at the time of diagnosis. With type 1 diabetes, normally we may wait for first 5 years, and after 5 years, every annual screening should be done for diabetic retinopathy.
Dr. Das, if I can come to you, how does high blood sugar affect the kidney? And can this become a life-threatening condition? How complicated is the treatment for nephropathy?
I think it's a very significant complication of diabetes mellitus. It affects between 30 and 60% of the diabetics. Now, the factors which produce diabetic kidney disease are usually the high blood glucose, and this interferes with the filtering in the kidneys. Therefore, 3 factors: high blood glucose, high blood pressure, coupled with a genetic predisposition, produces diabetic kidney disease. I must tell that this complication is one of the most important contemporary challenge, because about 50% of the diabetics have this complication at any time. It has been said below 65 years of age, it is about 30%. Above 65, it approaches 60%. Therefore, it is high blood glucose, high blood pressure.
Right.
I mean, that produces the diabetic nephropathy. We have no control over our genes. We cannot choose our parents. Therefore, it is important to control blood glucose and control blood pressure. And madam, I must tell you that there is a very important thing that is called point of return and point of no return. If you diagnose diabetic nephropathy early on, we call it microalbuminuria. When the albumin is showing in the urine, very minimally, between 30 and 300 milligram, we can totally reverse. But if it goes beyond that,
Right.
like a prodigal son, it is non-reversible.
All right. An important distinction that you're making there then, Doctor. Dr. Sujoy Ghosh, one term that we heard being thrown around or hitting the headlines over and over again when India was fighting the second wave of the COVID pandemic or in the immediate aftermath of this was mucormycosis, which appears to be a rare but devastating condition. But it seems to be far more likely to be seen in people who have uncontrolled diabetes. Now, are there any other fungal infections also apart from mucormycosis to which people with diabetes might be susceptible?
Yeah. Fortunately, the incidence of mucor has come down at least in the last month or so. It was really devastating to see so many people suffering from mucormycosis in the background of COVID. We've got to understand that diabetes is a state in which the body's immune system doesn't work properly. So it's a kind of an acquired immune deficiency kind of a state, as a result of which all kinds of infections are more common in individuals with diabetes, particularly more so fungal infections. Now, fortunately, most of the other fungal infections that occur in individuals with diabetes are less serious, but can still be harmful. For example, infection between the toes of the feet is very common. That can actually lead to an ulcer in the foot or infection in the foot, a cellulitis, which then progresses on to amputation. You can have nail bed infections, what is called paronychia. You can have very commonly infections of the skin, that's tinea. You can have fungal infections occurring elsewhere, for example, in the mouth, where you can have candida white patches. Women tend to have it very commonly when there is an infection in the genital tract. And you can even have infections within the body, for example, esophagitis and other aggressive fungal infections. But fortunately, the rest of the other fungal infections are relatively less common and more likely in individuals who've got very poor metabolic control.
Right. All right. Again, very comprehensive, very clear explanation there. Dr. Banshi Saboo, type 1 diabetes seems to be diagnosed very often in children. Are these children then also at risk of, all the complications we've discussed? How do children then deal with sort of serious complications? What advice would you give parents and caregivers?
So type 1 diabetes, yes, I agree that it is more common in children, but it can occur at any age. Primarily, it is the pathophysiology where absolute insulin deficiency is there. It is the beta cell which gets destructed because of autoantibody. It is more common in the children, and the children are also more prone to develop the complication as the duration of diabetes, and particularly when it is more with uncontrolled diabetes. So these children are also prone to develop the complication, and more often microvascular complication, which is in their initial years of like the first 10 to 20 years of uncontrolled diabetes will lead to them more complication like retinopathy, and as we were discussing about the diabetes kidney disease, which we see many of these patients. Now, how we can prevent it? The prevention is only by aggressive tight glycemic control, and that should be continued throughout the lifetime. These are the children who are having absolute insulin deficiency. They have to take insulin 3 to 4 shots in a day. They have to monitor it more frequently. And at the same time, every 3 monthly also, A1C is to be also controlled, which should be around 7 or less than 7 for these patients. If longer of the duration without any, uncontrolled diabetes, they can be prevented with diabetes complications.
All right. Thank you very much indeed, Dr. Das, Dr. Ghosh and Dr. Saboo for talking to us about a range of diabetes-related complications today as we take this deep dive into other diseases that are likely to be seen as a fallout of a serious diabetic condition. Thank you very much for your time, and for all our viewers tuning in, we hope your questions were answered and in fact you now have a clearer idea of what there is to deal with as India fast becomes the diabetes capital of the world. It's something that we just can't afford to ignore.